It's been a year of two parts. The first, a building of momentum to create a healthier Mid and West Wales. Then, a global pandemic, our biggest challenge yet.
Hello.
Hello. But one that we have faced united as a community. There has been much to celebrate in line with ambitions for people in Wales to have long, healthy and happy lives. We reduced some of our longest waiting times for operations in 2019 and delivered more day case surgery, such as hip replacements at Withybush Hospital. We reduced journeys for patients by installing an MRI scanner at Bronglais Hospital. Supported more people in their local high street, village or town, providing a quicker, more convenient service, such as our sore throat test and treat service for pharmacists to prescribe antibiotics. We worked on multi-million-pound projects to improve hospital environments and provide new state-of-the-art integrated health and care facilities in the heart of our communities. And worked in partnership on new ways of supporting our communities, such as Llanelli's Twilight Sanctuary, and technology in health, such as non-intrusive devices supporting patients at home to maintain their independence and offering families peace of mind. Our support teams worked round the clock. We provided 1 million patient meals and laundered 4.4 million items. We've collaborated with staff on award-winning leadership programmes, coaching, psychological support and building a compassionate, value-based culture. And our first Healthcare Apprenticeship Academy launched. 45 people who otherwise may never have entered a career with the NHS. We celebrated International Year of the Nurse and Midwife, engaged with them about their working lives and documented their extraordinary work on S4C nurses. Dozens of teams and individuals won prestigious national awards. Our Dyma Fi, This Is Me conference and values film celebrated and recognised the diversity of our staff and richness of their contributions. We protected the health of our people living and working in Hywel Dda. As we strive to reach national targets for childhood immunisation, we have made in-year improvements on the number of children receiving their childhood vaccinations which protect them from diseases. And we provided community screening for TB in our Llwyn Hendy community and care for affected patients. We engaged with people about local major trauma services and are now preparing to be part of the new National Trauma Network for Wales, improving outcomes for patients. We've introduced new ways of doing things. Thanks to work by our medicines management team and use of technology, mean we are now able to share patients' current medication across GP practices and community pharmacies within 24 hours of discharge. Matching finance business partners with teams to ensure safe quality services and value for our patients. Delivering a framework to support staff with quality improvement. Our pathology teams have helped reduce unwarranted tests, protecting patients from unnecessary procedures in hospital and the community. And different therapy services including dietetics, occupational therapy, speech and language therapy, podiatry and physiotherapy have collectively made improvements, for example, offering new types of support for children and families, such as the neonatal therapy team, who won a national award for work to reduce multiple disruptions and improve family attendance and satisfaction. We signed a charter to support our learning disability community to have the same choices and rights as everyone else. Our new website launched, fully accessible on different devices. Then, our world changed.
Coronavirus is the biggest threat this country has faced for decades, and this country is not alone.
2 patients from the same family in England have tested positive for coronavirus.
Our body does not recognize this virus from previously. That means we wouldn't have built up any natural immunity as a result of exposure.
All over the world, we're seeing the devastating impact of this invisible killer. If too many people become seriously unwell at one time, the NHS will be unable to handle it. From this evening, I must give the British people a very simple instruction. You must stay at home.
In response to the pandemic, we established Wales's first community testing units and a local command centre to provide critical information and guidance to staff and partners. Stood up 9 field hospitals to almost double our bed base in case of a spike that could have overwhelmed our local services. Had to stand down all but emergency procedures and access to critical healthcare services. Changed the hospital, primary care and community environments to abide by new regulations to keep our people safe through social distancing and infection prevention. Sourced and distributed PPE in the most challenging global market and established a central hub at Prince Philip Hospital. Provided digital solutions in primary and secondary care to transform the way we interact with our patients on telephone and devices. Prohibited most patients visiting for safety reasons, but delivered 220 tablets to enable inpatients to keep in touch with family and friends. Our GPs, hospital clinicians, care home commissioners and redeployed staff supported our care home residents and staff, including a mammoth testing programme. We've contributed to research and development into treating COVID-19, and we're continuing to adapt to the test, trace and protect strategy, working with local authorities and our teams from contact tracers to public health scientists and laboratory teams. We lost patients to COVID-19 in our hospitals and in our communities. Many others have survived, but the journey to recovery continues for them and for us. Our focus is now towards re-establishing care where we can as we live alongside COVID-19. We know the impact of this will be felt for years to come. We have been astounded by the support for our NHS in Hywel Dda. To our staff who have bravely worked through the pandemic, those that have shielded and worked from home, everyone who sent messages from the very young to older people and everyone in between, our partner organisations and other critical workers who kept us going, paid and unpaid carers, fundraisers, volunteers and people who offered kindness. For everyone who has sacrificed, thank you.